I love nursing. I really, really do love nursing, and I already feel like I'm living my dream job.
I know that in my day-to-day life, I'm changing someone's life. I could be saving a life when I go into work.
Of course, there's times as a nurse where you feel taken advantage of, but I think the brighter moments in nursing are far more common than the negative moments in nursing.
It really makes me feel excited to go to work when I know I can help someone and really help facilitate their process of healing. So my morning routine is I set my intention for the day, meditate in the mornings.
I listen to a lot of talk radio going into work, comedy, and then when I get there, I'm ready for my day, ready for the serious role in healthcare.
As this pandemic spreads and hospitals get overwhelmed, we are hearing more harrowing stories from healthcare workers on the front lines.
We're understaffed. We have so much on our plates as nurses.
America is not prepared, and nurses are not being protected.
This pandemic has really shed light on what nurses actually do in their profession.
We work in a very, very difficult profession where burnout is extremely high.
There's a lot of stress being a nurse. You're often tasked to provide direct patient care, but also be an emotional support for the families.
And not having the staff, the ancillary help, the supplies available to do your job to the best of your ability. Having time off is super important to take care of yourself and kind of just get away from the bedside.
We do need to have self-care, and I think it's really important to recognize when you're being burnt out so that you can take a step back, reevaluate, refresh yourself, and then get back in to take care of our patients.
Nurses' role in healthcare deserves a lot of recognition.
There's not one single other clinical position that I think is more important than nursing.
A lot of our work went unnoticed for a long period of time, and that was really difficult, going into an already very difficult profession.
Over the last year, we were exposing ourselves every day to COVID. And while that might seem like a heroic act, we were in the front lines far before that. But throughout the last year, we've been given this incredible voice. We've been given this opportunity to have a say in what's going on in healthcare.
Now we're kind of getting the recognition for the job that we do.
Nurses are critical to the future of healthcare, and so I think that after this pandemic, we're gonna have a different respect for nursing as we move forward.
Healthcare is going to be changed through nurses having a voice at the bedside, and I think we need to start taking care of the people that take care of the people.
My goal is to go back and get my doctor of nursing practice and hopefully become a chief nurse executive someday, so that way I can grow future leaders in the healthcare industry.
Ideally, I would start looking for a remote or telehealth job so that I can work remotely and still stay up to date at the bedside.
Definitely want to put myself outside of my comfort zone and just grow more as a nurse and grow more as a person.